Good evening. Welcome to the Toronto Debating Society. Tonight is September the 9th, 2014. This is a regular style debate with point of information. The resolution is childhood vaccination should be mandatory. The first speaker is the Prime Minister, Dean, who will speak to us for 7 minutes. Please welcome Dean.
Madam Chair, members of the opposition, and ladies and gentlemen of the House. The debate before us is childhood vaccinations should be mandatory. Childhood vaccinations is defined as inoculations or shots given between birth and roughly the mid-teens against a variety of known diseases such as mumps, measles, and the like. And should be mandatory is required by all with select exceptions to act in the best interest of the health of all society. Now, firstly, childhood vaccinations have been shown to reduce the incidence and or the severity of childhood illnesses, including influenza, whooping cough, measles, and the like. In 2008, the American Academy of Pediatrics stated that most childhood vaccines are 90 to 99% effective in preventing disease. According to a United Nations Foundation partner organization called Shot at Life, vaccines save 2.5 million children from preventable diseases every year. This is around the world. And roughly 285 children each hour. In addition, the Centers for Disease Control and Prevention in Atlanta estimates that in the United States, almost 750,000 children were saved from death and over 300 million cases prevented over a span of 20 years between 1994 and 2014 due to vaccination. And in fact, the measles vaccine has decreased the death rate by 74%. Stand up, please, if you want to ask.
Are you aware that they also claim that they are not 100% safe?
Yes, of course they're not 100% safe. Nothing is 100% safe. But if 1 or to 3 out of 1 million children pass away while the remaining children survive, yes, it's unfortunate for the parents and the family of the children who pass away, but in the greater scheme of things, many more children may have died and are likely to have died without the vaccinations being given. So you ask now, what's the benefit versus the harm? In Canada, the National Advisory Committee on Immunization has control over monitoring vaccinations. In Canada, before the measles vaccine, 300,000 cases of children under 18 years caught measles. 300 deaths and 300 were inflicted with brain damage. Now, in 2011, when that study was done, 50 cases of illness, no deaths. Whooping cough dropped down to 10% of its previous rate because of vaccinations. So there's also a financial and a social cost. People who have vaccinations are less likely to get sick, therefore less likely to be a burden on the healthcare system. Hospitalization costs are expensive. Keeping children home from school, expensive for the parents. In 2008, an unvaccinated child from San Diego went to Switzerland, got measles, went back to San Diego, and because 11 other children and other children beyond that were infected, it cost $10,000 per child in those 11 in the costs to monitor the disease, track the disease, and cure the disease with the shots when they were finally given it. That cost could have been used for something else. Celebrity spokespeople have convinced people in the real world that the Jenny McCarthy's and the like, that it's dangerous, it causes autism. Well, she backtracked on that after talking to Larry King on his TV show. She wrote an op-ed saying, well, that's not exactly what I said. but it was exactly what she said. And now people are saying, well, I don't want my kid vaccinated because he's going to get autism or she's going to die or whatever. Jenny McCarthy is a former Playboy model and a host on a TV show. She apparently has more power than medical practitioners and specialists in the public eye, despite the fact she doesn't really have any medical training. She has gotten naked apparently, so I guess if you're in a doctor's office, that's all right. Parents have choices not to vaccinate, as they should. And these are the exceptions. In Canada, you have the exceptional cases of religious beliefs or for the safety of your children if you so choose. At the same time, if your child is not vaccinated and there is an outbreak at the school, they will not be allowed to go to a public school because of the risk to them. And that's unfortunate for the parents who now have to bear the cost of keeping them at home or however they treat that. The territories and the provinces in Canada have seen a resurgence in measles, in fact, in the last few years. There was a CBC online article April 10th this year. In British Columbia, the Fraser Valley area, because of a private religious school that had parents from a particular church who did not believe in vaccinations, it caused up to 375 cases of measles to be seen in that part of BC because there was no vaccination to protect the children. Now, they may argue a causal effect, but it is there in the numbers. Quebec as well, 94 cases of measles in 2007, 725 in 2011, a huge jump. So these are realities when children are not vaccinated. We, as the government, believe that childhood vaccination should be mandatory because it protects society as a whole. There is a choice for parents who opt not to vaccinate their children as long as they understand the consequences and the ramifications. There has been proven more benefit to society as a whole as well as individual children, less harm overall. The deaths that do result, and there are from a variety of causes, have been minimized and they have been treated throughout the past years. Therefore, we request that you support the motion.
Hear, hear.
The next speaker is the leader of the opposition, Gurjot, who will speak for 7 minutes. Please help me welcome Gurjot.
Good evening, ladies and gentlemen, and over the government. Jefferson said right that government should just protect the borders and make sure that people get their mail on time. They shouldn't bother about other things and shouldn't intrude in people's life. And but how can government lie or how they can do any bad? So today we are here to oppose the motion that childhood vaccination should be mandatory. We don't believe so. So foremost, this is a case for the personal liberty, that people should have their own liberty, and vaccination policy should be voluntary, it shouldn't be entrusted upon people that they have to vaccinate. And then we will talk about the reasons why we think that it is a rational approach, that few people might have a rational point, and that's why they want to opt out of it. So first of all, just to talk about what government has said, that they have given some facts in terms of numbers and have said that there are preventable diseases and which can also kill children, and that's why they should be vaccinated. And those diseases are called as mumps, measles, chickenpox, and influenza. So first of all, vaccinations have the advantages and they have disadvantages as well. So these are not 100% safe. It's written on them there can be side effects and there can be other reactions to whoever takes it, like any medicine does. And that should, please.
Are there side effects to catching polio?
Side effects, yes, of course. If you have heard about 1955, there is something called cutting point. So there are two kinds of polio vaccinations, living and killed virus. And cutting point made that, and they made a there was a manufacturing defect, and 65 kids were paralyzed and 5 kids died. That was from the polio vaccine. And Dr. Salk admitted that, who is the inventor of the polio. Of course, there are side effects because there are so many things that are going into the vaccination, and there are so many toxins. There are foreign elements that are being introduced into kids' body. So there is mercury, and also Prime Minister talked about John McCarthy and the autism. There have been causal or there are other studies that we don't want to get into, but the main point is mercury is not safe for human. World Health Organization say there are no safe limits for mercury, and mercury is used as a preservative in all the vaccinations. So there is a great danger in introducing foreign elements to your body that are not natural to your body. Other thing that two other points that government made, also at the measles, mumps, and influenza, these are not life-threatening diseases. If somebody wants to opt out, even if they catch this, it can be cured in 2 weeks. It is not life-threatening. So people have a choice to opt out of it. And also government talked about a kid got measles from San Diego when they went to Switzerland and came back and gave it to other people. What does inoculation or vaccination mean? It means that you are in your body, that you are getting immunized. That means you are not getting immunized even after getting vaccination, that you are still catching that disease. So it is not serving that purpose. So it's up to them to decide. So even after getting vaccinated, you can still catch that disease. It's not immunization. And also, I will talk about my points as well. What we believe as opposition, the immunity is built by nutrition. Yes, please.
Sorry, you mentioned that influenza is not dangerous, but the Spanish influenza pandemic that took place in 1917 and killed millions of people apparently is not the same thing. Correct? So what government is mentioning, they can talk about Spanish or the swine flu as well. 1976 as well, in 70s there was swine flu as well. Government said that everybody needs to take the vaccination. It's the only thing they can do, but people didn't do it. They had to take back the program, and still millions of people didn't die. It is not because of the vaccination that you survive or you die. There are a number of other factors. Sanitation is the factor. That clean water is the factor. There are a host of other things that determines that something is contagious or dangerous. It is not just a vaccination. And also, the poor body nutrition and the poor environment makes our body's immunity even lower. Vaccination doesn't improve it. It doesn't say that vaccination will give you health. It's just saying it will immunize you. It is not replacing good health with that. Good health and good immunization comes with good nutrition, organic and whole foods that you can make your body better prepared. And our natural immunization works well for all our environment. And also I saw talk about the finances. That's a very interesting point. It all comes down to the business. Government and pharmaceuticals want to do business. So they are not just want you to just be safe from diseases. Has anybody done the long-term effects on the kids who are taking these vaccinations? What happens in 30, 40 years? There's autoimmune disease. There are a number of so many diseases that they are going through that are just like happening now. And also everybody is genetically and biochemically unique. There is biochemical individuality. So you can't treat everybody with the same thing. So you don't have one vaccination that you can say that, okay, that herd immunity is there. Everybody is different. Unless there is a personalized, individualized vaccination that takes care of each kid, unless that's there, everybody has their own belief and faith, and it's not religion.
that they are exempting on religious basis from inoculation, it should be rational basis. If somebody believes in natural immunity through foods, organic, whole foods, and clean environment, and they don't want their kids to have this toxins in their body, they should be free to do that. Thank you very much.
The next speaker is the government seconder, Jim. Please help me welcome Jim. He will speak for 5 minutes.
Madam President, members of the opposition, ladies and gentlemen, the leader of the opposition brought up the usual stuff that the leader of the opposition does. He brings doubt into the ideas of what the Prime Minister has so effectively presented as our case this evening. The ideas that the opposition are bringing up are that, well, maybe individuals do have the right to decide if they have inoculations or not. What we're talking about on the government in this example is that the benefits to society are greater than the benefits to the individual. We have no problem if the individual catches a disease that they want to catch, or if they smoke themselves to death or drink themselves to death. That's their personal choice. When it comes to a matter of communicable diseases that are life-threatening, this is where we in the government say that this is something that should be mandated as part of living in society. The leader of the opposition brought up the idea that some of these measles, mumps, rubella, these inoculations, well, if you catch them, they're not life-threatening. Well, as the Prime Minister pointed out, there are 300 or more cases of death caused by measles, mumps in a certain period of time. So the leader of the opposition, I'm afraid, is totally wrong. If you catch some of these diseases, some people will die. It is a given fact. We also have the leader of the opposition doing his best to convince you that as long as you eat good food and you have good water and hygiene, you're not going to catch these diseases anyway. Well, no, I'm sorry, ladies and gentlemen, it doesn't work that way. If you're in a room with someone that's got mumps, or someone who's got polio or smallpox or Ebola, you're going to catch it, more likely than not. And this is what we in the government are saying should be avoidable at not at whatever cost, but at the cost to the individual. Yes, sir.
Do you realize that vaccinations are given to build your immunity? So you shouldn't catch that?
Vaccinations are, in fact, typically what they used to be, the disease itself in a passive form. So you're actually being given, typically, the disease, but your T cells, and if you need an explanation of T cells, I can do that in the bar. So your T cells generate immunity to the disease without actually catching the disease. So obviously, we in the scientific side of the world realize what the vaccinations are doing, and are glad that the governments around the world are doing their bit to inoculate people against these various diseases. For example, in China, after a significant amount of inoculations in children, deaths from communicable diseases fell in 1991 from 61 per 1,000 to 12. Now, you can tell the mothers of those 50 children that would have died without inoculations, well, they shouldn't have had inoculations, but the mothers are going to just say, I don't believe you, my child is still alive because of an inoculation. I know there's statistics, but that's what actually inoculations are doing. Ladies and gentlemen, my own particular points here. We're dealing with a situation where society is involved. If you want to live in society, you have to be part of that society, and you have to understand what society means. The Prime Minister has outlined where certain people can refuse on medical or religious or various grounds, but the point is, inoculations should be mandatory for the benefit of society. It is not an individual's choice where society is involved, because you're a part of the society and you are benefiting from the society, and you are there to some degree as part of the society. So does the right of the individual counteract the benefits of society? We say not. If you want to smoke yourself or drink yourself to death, that's up to you. But if it's communicable diseases that people can catch and die from, we say no. Inoculations should be made mandatory. Therefore, ladies and gentlemen, please support the resolution this evening. Thank you.
The next speaker is the opposition seconder, Emily, who will speak for 5 minutes. Please help me welcome Emily.
Thank you, Madam Speaker. The government is taking an overly heavy-handed approach to a problem that could lead to bigger and worse things, a big brother approach. A couple of points I want to rebut that were brought up earlier. The financial cost, less burden to the system of a vaccination versus the disease itself. I think the government is forgetting how expensive it is to. I think the government is forgetting how expensive it is to roll out a new policy. When you roll out the government of late, when they roll out a new policy, it is error prone and has to go through legislation over and over again because people don't review it properly. So there's a cost of that versus keeping it at status quo today. So there is a financial burden when someone gets sick, but to implement this policy of making it mandatory for everyone is also very expensive versus the status quo. The point about Jenny McCarthy being a celebrity and getting naked and being able to convince people otherwise, maybe the government should consider putting, instead of rolling out reports that have many facts, they can also, in conjunction with that, become more media savvy. We're talking about people after all. All of the good things you said about vaccinations, I totally agree. They can prevent diseases, and if you convey that message strongly enough, people will listen. The basic premise of our argument on people's choice is that people are smart. Don't make the assumption that people can't make decisions. We can make decisions based on hard facts. So I'll go into my own arguments. So oh yes?
Can people also make decisions on hearsay and silly information that various actresses push to them?
They can, and that's why I'm suggesting that the government become more media savvy, because they must understand people. The government works for the people, so they must understand that people make decisions on many different things, facts as well as silly things. So maybe they pay Jenny McCarthy to do the same thing, and have her go naked and say all the right facts for them to make the right decisions. Like, the government should do things to help the people at the end of the day. So back to my points. So I'm going to focus on the word mandatory for children. So if these vaccinations are so important, why don't we make them mandatory for everybody? Why are children so special? Children are so special, but but why focus on just children? Why? And it's because adults won't let you, because it threatens your own individual liberties and freedom of expression. But we can impose these things on children and their parents. If the government is so concerned about the health of everybody, obesity and diabetes is an ongoing trend these days, and is expected to make everyone sick. So why not ration our food and the amount of sugar that we get? Why not make that mandatory? Because it affects our civil liberties, and that is one of the reasons why vaccination should not become mandatory. Maybe they'll say now that you need to exercise 5 times a day in a boot camp. Sure, that would be great for society and everybody, but do I want to go work out 5 times a day? I need to earn a living. Unless I'm a workout instructor, I'm not going to be able to do that. The role of so point number 2, the role of government is not to be a parent. This is a very slippery slope, again, for the reasons I mentioned before. The third point I want to make is enforcement difficulty with unintended consequences. How is this going to be implemented? Again, the government has exhibited has not been able to pass a law without having errors in it, which could be very expensive. But also there are consequences. In 1905 in Brazil, they tried to make it mandatory, and there were riots for days causing damage everywhere because people don't like their liberties to be affected. Will the parent go to jail? Will the child be restrained in archaic straps and forced to get a vaccination if they don't follow through with the law? What are the steps that people will take if this becomes mandatory? So, in those points, I believe the motion should be defeated, and that vaccination should not be.
Now the leader of the opposition, Gurjot, will speak for 2 minutes with this summation. Please help me welcome Gurjot.
It's pretty funny when Governor Sakander says that we who are on the side of the science, and they also exempt people on the basis of religion. That's pretty stark contradiction in the science and the religion and the reason of exempting people. To summarize, we as a opposition, we still believe that that people should have the liberty to choose whatever they wanna choose for their kids. At the end of the day, it's the parents who want best for their kids, and they don't want their kids to be sick or die from a disease if they think that a vaccination will save their life. But if they have the different opinion than government, and they think that building their immunity in a natural way by giving them a vitamin-rich and whole food diet and not injecting toxins and mercury and formaldehyde into their body, and if they think that's the best approach, they should be given liberty to choose so. So we oppose the motion, and we hope that government understands that vaccinations are less than beneficial than they are selling it for. So still advantages, let people choose it for themselves, and also take care that in enforcing all the policies to the people, then we take the very basic right out of their life, that is choosing for themselves, making decisions for themselves, and being a part of a free and independent nation. Thank you very much. That's the previous motion.
The next speaker is the Prime Minister, Dean, who will speak to us for 2 minutes. Please help me welcome Dean.
Madam Speaker, I just need to address some very quick points. The government is not who is reviewing vaccine effectiveness. Medical professionals throughout the world have reviewed the effectiveness of vaccines, and in scholarly journals have shown that they work time and time again to prevent disease and death. So the government doesn't even have to get involved other than to say, here's a facility to go get your shots. They're mandatory for children because their immune systems are weakest when they're young, and we're trying to build them up to make them stronger so they get old. And unintended consequences, that's how life is, and we stated that was how it works. Sometimes the vaccines work and sometimes they don't. But all in all, ladies and gentlemen, childhood vaccinations should be mandatory because they have been shown to reduce the incidence and the severity of the illnesses. The flu, whooping cough, measles, mumps, and the like. So if nothing else, people feel better rather than feeling really awful while they're sick or not sick. The benefit versus the harm. The reduction in Canada of measles through vaccinations, a significant drop from 300,000 before vaccines to 50 cases rather, is enormous. just because people decided, yes, I'll get a shot, considering all the factors and making individual decisions. Celebrity spokespeople are not medical practitioners. No matter, they might say, I play a doctor on TV, but they're not. Don't trust them. Listen to the medical professionals. And we still believe in the parental choice to vaccinate or not, but understand that your children may not be allowed to go to school if they're sick. Please vote for the motion.
And now for the adjudication of this wonderful debate, please help me welcome Dave.
Thank you very much, Madam Speaker. Well, if I do say so myself, wonderful is up to me to determine whether or not that's a true adjective for this debate. First of all, it was a great start to the season. It's great to see a great debate at the very beginning of the season, and of such a heavy topic too. So that was great for me just to see that. So I enjoyed watching this debate. Thank you. So I'm going to weigh this debate across the 5 categories which we are marking the debate on: argument, content, rebuttal, teamwork, style, and rhetoric. And I'd also like to say congratulations to the debaters for taking on the points of information and actually electing to do points of information. That's great. Sometimes we have a POI debate where no one actually asks any questions, and that always concerns me, but today we did. So, first of all, I want to talk about the arguments. The Prime Minister comes out and he's got these nice organized arguments. I can generally distinguish where one ends and another one begins. And the government seconder kind of ran at a time when he wanted to introduce some of his own arguments. I think we heard, and here's time for my points, and we heard the 1-minute bell. It's like, oh, there's going to be so many points, but he did get one out, so that's great. In contrast, the opposition, the leader of the opposition came out with a bunch of arguments, and so did the opposition seconder. So more individual new arguments came out of the opposition tonight. However, some of the arguments, I wasn't quite sure if they necessarily followed or connected with the resolution. Mostly criticizing the government, actually. Dean, it might have helped if I'd heard the arguments numbered. In fact, for everyone, if you could number your arguments, it would help me determine where one argument is, because otherwise, one of your arguments that I wrote down here was celebrities seem to backpedal and they have no medical training. And I couldn't connect that to celebrities are stupid to therefore childhood vaccination should be mandatory. I didn't get it, so I had to take marks off of that, and it just did not follow. And most seriously, your argument about exceptions such as religious choice should be allowed, again, that didn't follow at all. Like, religious exceptions should be allowed, therefore childhood vaccinations are mandatory. That didn't connect for me at all. And actually then I thought, oh no, the government has left a huge hole open because of that failure in the argument, and the opposition left it alone. The only mention of it was in your summation, Gurjot, and you very neatly, you went into your prepared remarks about your arguments that you've got about it's personal liberty, not safe, and you really should have jumped on that right away. And that's where I'll start talking about the rebuttals. So I'm just going to skip content for the moment, so moving down to rebuttals. And the opposition did have some rebuttals, but I found they kind of missed. They didn't really connect with what the government was actually saying. Like, you have to listen to what the argument means and then attack the substance of that argument for it really to go anywhere. And for in contrast, the government, you actually had some excellent the government sector had some excellent rebuttals against the leader of the opposition, characterizing it in general that they're just trying to cast doubt and then kicking it right back to, no, these are really big life-threatening issues and that good food is not enough, so really hitting the substance and getting to the crux of the debate right away. And tackling the liberty point as well, saying you can smoke yourself to death if you want. We don't care. So excellent rebuttals from the government, some work to be done from the opposition side. And actually, I will characterize a lot of what the opposition said as rebuttals as simply questions. Like, Gurjot, I heard you say, has anyone done any long-term studies? I don't want to hear that. I want to hear someone has done a long-term study and it shows these negative side effects. I want to see facts that rebut what their arguments are, not questions that just cast doubt. That's a weak rebuttal. And I heard the same thing from you, Emily. Well, not the same thing, but will the parent go to jail if it's mandatory? Like, all of these kind of fluffy questions that don't really connect. Like, they cast doubt, they're okay, but they formed the basis of a lot of your rebuttals. And now I'm going to talk about content, and I'm not going to be able to speak very much time about it, actually, because the opposition, I didn't really hear any source references at all, ever. And I was listening. I tried to hear, like, they need to be media savvy because of this study that Facebook said, or anything. I didn't hear a thing. I heard one scientific stat that there's no safe limits for mercury. According to whom? And if it was there, I missed it, but it must have been less than 1 syllable long, but there was nothing, no sources. And the government, much stronger. I heard American Pediatrics, UN Partner Report, CDC, a case study, measles resurgence rates, very heavy of content from the government side. And also the opposition, the government seconder mentioned this scientific foundation around T cells and used a China study about the rates in 1991 and the falling rates. So much heavier, 2 minutes, thank you. Much heavier content from the government side. I'm going to talk about the points of information for a second. This is part of the rebuttal and refutation category. I did take 1 point off from the Prime Minister for a question that was just a little bit too long. You really set up that Spanish flu. I knew the question. They knew what you were asking. You didn't have to put that much substance behind it. So I took one mark off, but I put 1 mark back onto your side because of Jim's rapid-fire question, are there any side effects to catching polio? It was great, undercut the case. It was a great POI, so you got 1 bonus point for that. So it evens out. On the opposition side, I think the leader of the opposition was the only one that handled any of the points of information on that side. And, well, for one, I think just remember to stand up when you're asking your question. That's all, just to make sure that they get your attention. And otherwise, I didn't think that you handled the questions very well. When they would ask a question, I didn't think that your answer was necessarily a dodge, but I didn't think it really was on topic either. I thought we kind of just continued with the debate, and I wish it had been addressed some way at all. And so I took 2 marks off of that. That just takes some practice, just to kind of to fine tune that. Quickly, I'll talk about teamwork and style and rhetoric. So teamwork, the government worked really well together. They had some joint reinforcements of their arguments, so they did very well. Whereas the opposition, I found that their presentations were kind of in silos. They didn't really work well together. The arguments kind of seemed mutually exclusive and didn't really talk about the same kind of things, with the exception of like the personal liberty, which was the foundation of your case. And for style, I thought everyone did a great job just coming up here and speaking very clearly. And Emily, you were quiet in the very beginning, and one kind audience member was just saying, louder, louder. And you did. You got louder right away. So I was like, that's great. Now I can hear you. And that was great. Jim, one comment for you is that you did a lot of speaking directly to this side, even when you were just making general comments, not addressing points of information. Keep your comments out to the audience or to the chair. But otherwise, just like 1 or 2 marks off for that one. And otherwise, some great presentations. The final scores is the government has won the debate with a score of 57 to the opposition's 31. So not bad. Some problems, room for opportunity on both sides. And the best speaker was Dean. So if I could see the Prime Minister. Congratulations. Madam Speaker.
Excellent. And the people have spoken. The popular vote tonight is 10 votes for the government and 4 for the opposition. And therefore, the government wins again.
Go ahead.
Well done.